Well, I wanted to thank Saskia again for her wonderful talk. I really feel like Saskia laid out for us some of the challenges and some of the strategies for us for the future. And I especially appreciated her emphasis on thinking differently. So I think that should be our theme for the day, thinking differently. I'm really honored to have the opportunity to host this panel, Our Voices from the Field. And this has really been a dream for me for many years, to have a transdisciplinary conference, a trans-regional conference that brings together people across our different disciplines of dentistry, medicine, nursing, public health, and from different academic institutions to have the opportunity to build a stronger bridge between us here at UC Berkeley and UCSF, and to include people from the communities as well, nonprofit organizations, businesses, and also to focus on both the local and the global, since we have so many of the same challenges. And I really think that together we can share some of the strategies that can move us forward. So first I wanted to thank our funders for this program, Global Healing and Health Roots, who have made this possible, and our UCSF and UC Berkeley coordinators, especially Hildy Fong, who has done a tremendous amount of work to bring this together, our volunteers, our speakers, and our audience for coming today. While I have had experience in global health for about 35 years, I'm actually a newcomer to the field of oral health. My training is in medicine, in pediatrics, and preventive medicine, and public health. And it's only been in the past 10 or 12 years that I've really been grabbed by this issue of children's oral health and realize how important it is to their nutrition and overall health. This is actually when my education in global health began. Many of you might have seen this photo. This is me in the late 70s. After I graduated from college, I was a Peace Corps volunteer in rural Ecuador. And while they had many of the health problems of poverty, there was respiratory diseases, diarrheal disease, the children ate straight from the farm, and actually they had beautiful smiles. I didn't even think that oral health was a problem back then. But then when I came back and worked in Latin America 20 years later, this is what I saw. Children were showing up for our health camps, eating junk food, and this early childhood caries was so severe. I had never seen that before. And it really saddened me and it angered me. And it made me realize this is something that I needed to devote my career to working on. Since then, I've had a chance to travel all around the world, Latin America, Asia, and Africa, and talk to health professionals and families and children all over the world. And unfortunately, this is what I've seen, that we have this problem everywhere. It's especially because we've had this tremendous nutrition transition. From the traditional diet to the modern diet, from breastfeeding to bottle feeding, from eating straight from the farm to eating our processed foods and sugary foods and drinks, and from our 3 meals a day to continual snacking. So this is a real tragedy that we're facing this. And the families have told me that their children are suffering. And even though we've had discussions globally about this dual burden now that we're seeing of malnutrition and non-communicable diseases like obesity and type 2 diabetes, there's also a parallel pandemic of early childhood caries that hasn't been adequately addressed by our local and our global public health authorities and our healthcare systems. So clearly, this is a problem that needs both prevention and treatment. But what is the right balance between prevention and treatment when we have limited resources? What is the right time to intervene? And who needs to be our partners at the table for making a difference here? So I've been thinking about this, and with my public health hat, I put together this graphic that when we have a problem, these are mouths with caries in them, when we have a problem that affects now the majority of our young children, it's so great that we'll never have enough dentists to take care of and treat this problem. And maybe on some children, they can have a good outcome there in treating their caries, but in many children, we're not going to have an outcome that's really satisfactory, and we have so many children here who are untreated. But if we train our community health workers, nurses, preschool teachers to really focus on prevention out in the community, we can lower the prevalence of this problem. And then they can also be referring the children who need treatment for their tooth decay to the dentist, and over time we'll really have a lot less burden of disease in the community, and then our dental treatment system can take care of it, and we'll have a happier future. So I'm just really delighted to have today our voices from the field. This is so important to have our colleagues here speaking with you. I've learned a tremendous amount from my colleagues from all over the world and listening to the families in their communities. Our colleagues here are public health professionals and child health advocates who are rooted in their communities and culture, and they can really tell us the context of children's oral health within their overall health, within their family life and their community life. They can describe the innovative ways that they've been working with children and families to really try to promote children's oral health and nutrition by incorporating oral health into general maternal child health services from pregnancy and infancy, and they can tell us about the impacts that they've seen and their hopes for the future. So, as a wise friend told me, we have 2 eyes, 2 ears, and 1 mouth, and that we should use them in that proportion. So I will stop now and use my ears to listen to our voices from the field. And I trust that you will also be as inspired as I have been from hearing them. Thank you.